Mm-hmm. Hmm? What are you supposed to do? Introduce? Are you ready?
Yes.
Okay. Good afternoon, everyone, and welcome to our channel. We really apologize. We've had a small challenge with the connectivity, but we are now finally live. Today we would like to have an interactive session with you people and have a chat about kidney health, prevention of kidney disease, promotive and preventive habits that can help us all have healthier kidneys and prevent kidney problems. And then for those who might be ailing for kidney problems, we'll try and answer some of your pertinent questions as well. So welcome everybody. With me here we have Ken Limo. Ken Limo is a clinician. Are we able to pan on to Ken? Ken Limo is a clinician who works with us. He did his training at the medical training college, and then he did public health degree, and then he has a higher diploma in nephrology, and he helps us a lot with seeing some of the kidney patients, and also helps us with arranging and preparing people for a kidney transplant. So Ken, any questions so far from the group or from the wall?
So far, no. We will just do a quick presentations on kidney health, and then we get for questions.
Okay.
So one of the questions that someone asked is, what is the cause of kidney failure?
Yeah, so a very common question we deal with is what causes kidney failure? The commonest cause of kidney failure is diabetes. And this you'll see mostly in people who are older than about my age, probably people who are older than 40. Most of the time when they get kidney failure, it's due to diabetes. Another common cause of kidney failure is blockage of urine. We get exposed to something, usually an on appropriate and working as to target. If the blood pressure remains high for long, it eventually leads to kidney damage. So that's probably one of the other common reasons why kidneys fail. Sometimes we have some inherited causes of kidney failure. What we call polycystic kidney disease is one of those common things. Those ones, again, that's usually due to a lucky break. It might be, it's a genetic issue, so it tends to run in families, but sometimes we've seen patients who come from a family who do not have this problem. And sometimes you can have what we call a sporadic case where you end up being the first person in your family with polycystic kidney disease, and then from there, it gets passed on from one generation to the next. But that's usually not so common. So in short, the commonest cause of kidney failure is diabetes, and then we have obstruction of urine or blockage of urine, and then we also have uncontrolled high blood pressure, and then we have what we call nephritis or glomerulonephritis. That one can be a bit difficult sometimes for people to understand, but it comes out of nowhere, usually following an infection. Sometimes it can come out of completely nowhere, and sometimes we ask people whether they've had infections and we don't seem to identify anything.
Someone has asked that how long do you take to diagnose kidney failure?
The diagnosis of kidney failure should be not too difficult. For us in the profession, we go through a process. We ask you questions, or we take a history from you. We examine you, we check your blood pressure, we check for the presence of swelling in the legs. But more importantly, to confirm, we normally do a test, a blood test. And the blood test should be out in 15-30 minutes. And that usually would show us whether the kidney is functioning well. We check for what we call a kidney function test. And there are certain numbers there like urea and creatinine. When they go up, it's an indicator of a failing kidney. So it shouldn't really take a long time. If you visit a doctor today, within 30 minutes, you should be able to get an answer as to whether your kidney is working normally, or easy to make a diagnosis of kidney failure.
The other thing is it only in families, or it can also happen to an individual?
For the most part, the kidney failures that we see tend to be individual cases. It's not often that we see a whole family being affected by kidney problems. It's not very common. It tends to be individuals within a family. So don't be too scared if a family member has kidney failure. It's not automatic that you'll have kidney failure, but it actually usually means that you need to have yourself checked early enough, so that in case there are issues that need to be addressed, and so that you can prevent kidney failure from coming to you as well.
When do you have people go to dialysis?
When do we put people on dialysis? A very good question. So number one, we need to be sure you have kidney failure. So we'll have to make that diagnosis or that assessment that you have kidney failure. But not everyone who has kidney failure will need dialysis. So we look at certain things. We look at your general health. So if your lab results show that you have kidney failure, but if you're feeling well, you're not having nausea or vomiting, you're eating well, you're not swelling too much, and we can control the swelling with medication, we can control the blood pressure with medication, we can usually just control your we can control your issue with just medication and follow-up. When people need dialysis is when the kidney failure is advanced. And advanced kidney failure is characterized by, you feeling tired all the time, you're nauseated, you can't eat, you're vomiting, your chest is congested, your legs are swelling too much, and despite giving you the water tablets, what we call Lasix, which makes you pee more and more, there are people who, despite us giving them those medications, they're just not getting better. The swelling doesn't really go away. And the numbers of urea and creatinine are so high. Usually what we would call a stage 5 kidney failure. It's at that point really that we say, okay, it seems like you need to go on dialysis. So we try not to put people on dialysis unless we have a good reason, because for you to be on dialysis, it's a commitment. You're coming in Kenya, for example, you're coming in for dialysis twice a week. And that's really a significant interruption of life for people, because people have work, people have families, people have things to do. So if you have to come in, spend 4 hours on the machine, and that's just 4 hours on the machine, there is time that you need to come in, then there is the 4 hours on the machine. There might be some waiting time, and then there is time after you finish, and then there is the tiredness, you know, and the feeling washed out that occurs after dialysis. So for most people, really, that day they are on dialysis tends to be a wasted day. And then you're talking about 2 days of dialysis, which is what is standard in Kenya. In other countries, especially in the West, Europe and America, and even countries like South Africa, people have to go for dialysis 3 times a week. So that's a really significant interruption to your daily routine. So because of that, we don't put people on dialysis without really thinking hard about it, and usually having a discussion with the patient, going through some counseling sessions, so that we make sure that people really understand that it's a commitment and you have to be available and be willing to come in 2 times a week. It's a bit easier when your kidney failure is really advanced, because by that time you're feeling terrible, you know, you're really feeling bad. So even if you have to forego 2 days of normal life, in terms of you're not going to work, you're not staying in your house, it's usually a good compromise compared to how you're feeling. So yeah, but for someone who is feeling great, is not having nausea, is not swelling, the kidney really has abnormalities, but they're feeling great, then it doesn't make sense to put such a person on dialysis. The other thing, of course, is dialysis costs money. We're lucky in our country that that bill is taken over by NHIF, which is the National Hospital Insurance that we have in our country. So that pays for it. But you see, it's a cost still. Someone is paying for it. We are all paying as taxpayers for that NHIF. So we try and make sure that it is justified. We don't just put you on dialysis unnecessarily. But also, we make sure that we don't hold you back from dialysis until it's a danger to you. So it's a judgment call, and doctors recognize, we kidney specialists take a lot of time to think through. We discuss with the patient, we discuss with the family, and we make sure that everyone is in concurrence once we think that you need dialysis. So it's not something that is taken lightly, for sure. Any other questions, Ken?
Someone has asked a question here about laparoscopic transplant. And when do we do it, and what is the cost?
Yeah, that's a really excellent question. So there's this thing called laparoscopic surgery. So laparoscopic surgery is very unique in that, you know, the traditional surgery, for any form of surgery, we have to cut a big wound in your tummy or wherever, usually in the tummy for most people. We have to cut a big wound and then go into the tummy to access organs. Now with laparoscopic surgery, we don't cut big wounds. We make small holes, they're called keyholes, and then we use cameras which are probably the size of my pen. So sorry about that. So we have cameras which are this, they're in a, you know, they are attached to the end of a tube, which is this thing. And these cameras now, then you put them inside someone's body. And then at the end of the camera, there are holes where we can push in instruments and do things inside your tummy. So because of that, people recover faster. You don't get a lot of pain. And cosmetically, in terms of the look, you don't get big, ugly scars after the surgery. So laparoscopic surgery has really revolutionized surgery. Now, when it comes to kidney transplant, we reserve laparoscopic surgery for I'm sorry, there's a microphone here which dropped. I have to put it back. So we reserve laparoscopic surgery for the donor surgery. So the donor, traditionally we cut a big wound here by the side, and then we go in and remove the kidney. But when we do laparoscopic kidney removal for the donor, we actually make small incisions in the front of the tummy, and we go in and harvest the kidney. So transplant surgery is amenable to laparoscopic surgery, but only on the donor side, on the removal of the kidney side. And that is advantageous because, remember, the donor is volunteering, voluntarily giving their kidney. And we don't want to make them feel like it's a big sacrifice. We want them to just sacrifice their kidney, but not go through a lot of pain in the process. So that laparoscopic donor surgery then makes a lot of sense, because they go in, it's a small surgery, it's not too burdensome to them. The recovery is usually very, very fast, and they feel great within a week after the surgery. And because of that, laparoscopic donor surgery is very, very useful. Unfortunately, in our practice, we are yet to fully use laparoscopic surgery in Eldoret town. But it's coming up. I think Kenyatta has now laparoscopic donor surgery, which is really going to make a big difference and make the donors not feel like they're suffering to actually donate their kidney. Now, on the recipient side, the person receiving the kidney, we are still not able to use laparoscopic surgery. We still do the big cuts, and largely because, implanting or placing in a kidney really needs quite a bit of space and a lot of maneuvering, and that cannot as yet be done by laparoscopic surgery. I hope that answers the question.
Thank you, Billy, for very good that question. And the other question is, which are the safest painkillers in kidney health? And yes,
another, yeah, that's another excellent question.
Paracetamol is said to be one of the safest painkillers, but as perception is, can paracetamol cause kidney damage, as people say?
Yeah, very good question. So talking about painkillers and kidney damage, look, my thinking is, let's try and use medications only when we have to, because no medication is completely 100% safe. People can get reactions to medications, and not necessarily reactions in the kidney. You can get reactions in other organs as well to any medications. So when it comes to painkillers, the safest medications for in terms of kidney health are those that are not NSAIDs. So we have a group of painkillers called NSAIDs, or non-steroidal anti-inflammatory drugs, which includes things like aspirin, diclofenac, aceclofenac, ibuprofen, naproxen, celecoxib, etoricoxib, and things like that. Commonly Brufen, Zulu, of course aspirin is usually aspirin, and things like that, Ecofree, Cellcox, and things like that, Celebrex, and so forth. So that group of medications, they are very good for controlling pain, but then they have the potential of affecting the kidney. If used in a limited time period, they are okay. But the problem is using them over a prolonged period of time, which we see a lot in patients with ongoing pain. So if you have to use the Brufens, the Zulus, the Ecofree, the Cellcox or Celebrex for long periods of time, then it starts being an issue, because it might lead to problems in the kidney. But if you're using it for a day or two, then that should be fine. But of course, then we should not be using it a day or two this week, a day or two next week. Again, then that might be an issue. They're also especially worrisome when used with other similarly harmful medications. So be careful if you have to use them with other medications, because then the effect can be multiplied. And then they're also a bit dangerous in situations where your blood pressure is going down. Maybe you're having severe diarrhea, maybe you're having a lot of fever and you're dehydrated. Then they tend to now be a bit more toxic to your kidney. Now, so those are the medications we advise people to be really cautious about. In terms of safety, paracetamol or Panadol, which is the common one in this country, they're fairly safe. But again, you have to be careful. You are not using severely, huge doses, because again, then it becomes a problem in your liver. So Panadol is good when used for pain, but also do not exceed about 8 grams for most people. Once you exceed that, then you again are risking effects on your liver. So if you have very bad pain and you need to be on painkillers for long, have a discussion with your doctor so that they can choose for you medications that are safe for your kidneys. And this would include now the higher order painkillers like tramadol and maybe morphine or fentanyl for the very severe pain like cancer pain. But usually I would advise that this is not a decision for you to make on your own. It's best that you discuss with your team of doctors at that point. And these are medications really that you tend to see for the very severe pain and the, what we call chronic debilitating pain. For example, people who have cancer.
Someone has asked a question here. Can a patient recover fully from kidney failure without going through dialysis?
Yes, yes, yes. So remember that when your kidney fails, it can fail in 2 ways. There's what we call acute kidney failure, and there's what we call chronic kidney failure in general. So acute kidney failure comes very quickly. It's usually due to an insult that has come rapidly. For example, if you have cholera and you have profuse diarrhea and you're having a lot of diarrhea, you get dehydrated, and at that point the kidney might shut down because of the extreme dehydration. Now when you get dehydrated, that kidney will shut down, but if you are seen by a medical professional within a short period of time and fluid administration is done so that we correct the dehydration and we treat the cholera, the kidney has a very, very good chance of recovering 100%. But then we have chronic kidney failure, and chronic kidney failure occurs when your kidney has been receiving insults and persistently over time. And this is what we see more often in people who have diabetes, where you have high sugar, it's not controlled over time, and that insult would be insulting your kidney, causing injury to your kidney consistently over a long period of time. And eventually the kidney would now be significantly impaired, that the chances of recovery are low, and that's when we call it chronic. Those are the people who now the chances of recovery is usually so low, and they would usually then have only the option of dialysis or receiving a kidney transplant. So in short, not all kidney failure is unrecoverable. Some kidney failure can be recoverable, and if doctors are on your case, or if you receive medical attention within a timely period of time, there is a very good chance of full recovery. And this is what we see in acute kidney failure, especially due to infection or due to severe dehydration, when you lose a lot of fluid, maybe from diarrhea or vomiting or from blood loss. If that is corrected within a period of time, the chances of recovery are very high, and usually people make a full recovery from that. Also, the glomerulonephritis cases, those people, if they come to hospital in good time and they receive the right medication, the chances of full recovery are usually very high.
Another question is, if you go through the dialysis
Yes.
for how long would you probably sustain on dialysis?
Very good question. If you have chronic kidney failure and you need dialysis, and then you're put on dialysis, how long do you expect to live? That's a very good question, although it's not a straightforward question. It depends on a lot of things. It depends on your age. It depends on the medical conditions that you have as well. And it depends also on the status of your heart and any other medical conditions that you have alongside the kidney failure. In general, people can live. I mean, there are people who in other countries, I think I know in South Africa at least, there was a patient who got dialysis for more than 40 years, I believe. So it can happen. But in Kenya, in Eldoret here, there's a patient who I know, we started her on dialysis in 2007. So that's 16, 17 years now of dialysis. But you see, she started dialysis when she was in high school and she was young. So it depends on age, it depends on the medical problems that you have. The people who are older, and especially if you have age, advanced age, maybe you have diabetes, you already have a weak heart, those are people who their expected lifetime on dialysis might not are common for those people who develop symptoms. Remember, not everyone will have symptoms. For those who develop symptoms, some of the common symptoms include swelling, they include reduced amount of urine, it includes feeling tired, nausea, vomiting, muscle cramps, and symptoms of anemia. But those tend to really come late. So I think it's really important to say that it is possible that you can have signs, and that's why it's really important to go for medical checkup.
Thank you.
Question. So when people go through a transplant, it's interesting. The human body is designed very interestingly. So when you receive an organ from someone else, your body wants to fight it. And that's why we give you medications called anti-rejection medications. And of course, those medications are expensive. Some of them have side effects. And one of the common questions we hear from our patients is, when am I going to stop these medications? Unfortunately, so far, we don't have a great solution for that. Most people will still need to be on lifelong anti-rejection medications. We adjust the medications, and generally the doses that people stay on in the long run are way, way less than when they start off, like in the first 3 months. But so far, I don't think we are still able to guarantee anyone that you'll receive your kidney transplant and not need any medication. I think I'll be lying if I said so. So just be a patient, but I think something will be discovered in future. So let's keep tuned.
If you're on dialysis because of end-stage renal disease, at that times you'll have dialysis honeymoon.
Oh yeah, that's an interesting question. Dialysis honeymoon, basically that means that you get dialysis and then for a while we are able to stop dialysis and then they don't need dialysis. But then maybe later the chronic failure goes on and progresses and they get back on dialysis. It can happen, back on dialysis. It can happen.
Thank you. Talk about the energy drinks that we have and the drinks that can have injuries to the kidney. And what is the amount of water that someone is required to take to maintain their kidney health?
Yeah. I have to be careful because, there are various energy drinks out there. Some of them are proven to be healthy and good and not harmful. Some of them we don't know whether they're harmful. And some might have been proven to be harmful to people. So I don't want to generalize, and I don't want to, remember these people are also running businesses and they're fending for their families. So it might be unfair to just, give a blank statement about whether all energy drinks are harmful and so forth. So I think, like everything, we say that people need to use things in moderation. Remember that it's the overdoing that tends to put us in trouble. Remember, even with food, the why people get diabetes sometimes is because they're just eating too much food or too much carbohydrates. So too much of anything is harmful. So for the energy drinks, I think if you use them in moderation, it might not be an issue. And I think that I'll leave it there because we some of them are proven to be healthy and not harmful, and some of them might be questionable. Now, talking about what yes, a small hitch with a microphone here. So, does kidney failure affect children, and what are the causes of kidney failure in children? Yes, kidney failure can affect children, and for children, it can range from blockage of urine. We tend to see this in young boys, but also they can get genetic causes of kidney failure. This polycystic kidney disease can affect children, although it's quite rare. But the commonest reason why we see children getting kidney failure is usually due to infections. So when they get severe infections, their kidneys shut down, and some of them get this glomerulonephritis. Usually that follows an infection. So children can get kidney failure as well, and it's not just for adults.
On transplant, someone has asked here, Kirui Korea asked, is it possible for a patient to get a second transplant after the body has rejected this first one? And how many transplants should you get if you get rejections?
That's a very, very good question. There's hope. I know we've had patients who have received a kidney transplant, number one, and then that kidney fails or gets rejected. It doesn't mean that's the end of the world. I think at our office here, we have at least, I think, 5 people who've received a second kidney transplant. So you can actually get a second kidney transplant when the first one fails, even if it fails due to rejection. Usually it's a question of, is it safe and is it likely to reject again? And once we are clear with that, we can do a second kidney transplant. So it's not the end of the world if you receive a kidney transplant and it fails. We can usually do a second one. How many can you have? So we look at the blood vessels that you have and which ones are amenable. So normally the first kidney transplant, we put it next to your groin on the right leg, and then the second kidney transplant, we put it another kidney transplant after that. We can still do it, and we will put it inside your tummy. And I think we can do up to 4 kidney transplants probably before we start struggling. So up to 4 kidney transplants can be done for most people.
And if another question is, if I'm doing a kidney transplant, are the old kidneys removed or they are left there?
Very good question. So when you receive a kidney transplant, do we remove the old kidneys? No, we do not. We don't touch the old kidneys. We leave them there for the simple reason that they usually are not causing any trouble. And in any case, going the length of removing those old kidneys, it's a lot of surgery with a lot of potential problems. So we try not to do anything to the old kidneys unless they're really bothersome. And there are situations when we really remove those old kidneys. Like, for example, people who have, the kidney failure is due to infection in the kidneys. Then because these kidneys might keep being a source of infection, then we remove them. We also remove kidneys sometimes in people who have polycystic kidneys. And polycystic kidneys are huge fluid-filled kidneys that can be bothersome to some people in terms of giving them pain, giving them abdominal or tummy discomfort. And in some people even they struggle to eat. And in such cases we remove those huge massive kidneys, and we do it just for the comfort of the patient. So it's not common, but sometimes we do it.
Someone is saying, thank you, Daktari, you assisted my father-in-law, and he's saying thank you for the good work you're doing. Another question is...
we appreciate that. Thank you.
Another question here from... If I have to go through dialysis, what advice would you give me or a patient who is scheduled for a transplant in terms of his planning and in terms of his diet?
Oh yeah, for dialysis or transplant?
Dialysis.
Yeah, so if you're scheduled to start dialysis, usually you'll have a sit down with your kidney doctor. We call them nephrologists. And normally also you'll have a sit down with a counselor. And usually, again, there'll be a session with a nutritionist. And we give plenty of advice about how you should eat, what food choices you're going to make, and what things need to be eaten more and what things need to be eaten less. We try and be tailored so that we don't give a blanket diet to everyone. We try and look at your circumstances, because every patient is different. We look at your circumstances and we advise you according to your circumstances. In general, for most people, we tell them to be really cautious with the amount of water that they drink and the amount of salt that they take. So we recommend for most people a low salt diet, and a fluid restricted diet. Just because salt and fluid, they tend to make you swell more, they tend to take your blood pressure up, and that's why we restrict them. We also look at food that contains potassium. There's something called potassium, which is present in abundant quantities in plant-based foods, especially the citrus fruits, the oranges. We also see a lot of potassium in bananas, avocados, and we see a lot of potassium in the greens, in the green vegetables. So you'll find us restricting those foods simply because they contain a lot of potassium. And when your kidney is not working well, your ability to eliminate potassium is usually impaired. So that's why we restrict some of those foods. But I would advise that if you need dialysis and you need to understand what foods you need to take, it's always good to sit down with your kidney doctor and your nutritionist to have a more tailored, or a diet that is suited for your circumstances, because not everyone is the same.
There's a commonly asked question here, is it possible to go through kidney transplant without having dialysis?
Oh yes, that's a very, very good question. Are there situations where someone goes from kidney failure straight to transplant without going through dialysis? Yes. In fact, that would be the best case scenario. That's what we try as kidney doctors to do, and that's why we encourage everyone to go for a checkup, because if we pick you up early and we realize that your kidney is failing in the long term, we would actually tell you, look, at some point you might need dialysis, but at that point also it means you need a transplant. If you're able to then get prepared and go straight to transplant, it's much better for you than going through dialysis, getting stuck, and then later on going for a transplant. So it's possible, and I think in our practice we've done some people where we've actually taken people straight from chronic kidney failure straight to transplant without going through dialysis, and that would be the ideal case scenario.
Someone asked a question here that in the US there was a kidney harvested on a pig and transplanted to a human.
Yes.
How viable is that, considering the genetic difference of human and animals?
Yeah, that's a very good question, and that's a nice question. Yes, a couple of months or maybe a few years ago, scientists in the US took a pig and they then harvested kidneys from the pig. They implanted those kidneys onto a person with kidney failure, and that pig kidney worked, and it was a proof of concept experiment. More improvements to the pig kidneys be done, so that in future, when someone needs a kidney, we don't have to burden someone else. We don't have to ask your sister or your brother or your mother or your father for them to sacrifice their kidneys and to sacrifice their time and to go through the pain of surgery to get that kidney and be given to you. If we are able to get these kidneys from pigs, it would be probably a better scenario, and especially if it's proven to really work well. It might be the way to go for the future. So we are really, even ourselves, really hoping that these developments can be refined further, and that the scientists get it better, and transplantation. And it would be just risky for the recipient. We're not putting two people through danger. Going through surgery is not something easy. So when you have to put two people through surgery, we really have to take our time. We have to be very cautious. But when we're using pigs, then it's just the recipient that we worry about. We'll still, of course, make sure that we do our due diligence on the pig kidney, but at least it moves some of the barriers that are currently there between someone needing a kidney. Further developments will be coming up in that area.
Thank you. Journalist Masinde is saying, Salimia Daktari.
Hi, Masinde.
And then someone else is saying, the same Masinde.
To make your life better, to make your condition better, might not be in play at that point and might be futile. Yet if we go early, if a cancer is picked up, solutions make your quality of life better and even potentially cure you completely of that problem. So it's still important to go after the kidney transplant. You'll need to be going for checkup, you'll need to be doing blood tests, you'll need to be on the anti-rejection medication. And those medications can cost somewhere between 30,000 a month to maybe 50,000 a month plus or minus. And that's really the cost that we ask people to really be cognizant of, because sometimes people commit, they raise money for the preparation and for the operation, and then they forget that they'll need money for the after. We're lucky though that with the new social health authority that's coming in, that problem will be a problem of the past, because the social health authority will actually be paying for the medications after a kidney transplant. So I think this is something to encourage you people, that now all we'll need to be worrying about is getting a donor, getting ready, doing the tests, and going through the surgery, and after will be taken care of after kidney transplant. And after the kidney transplant, we really, really encourage you to take care of your sugars very, very well, because we don't want that diabetes to come back and damage the new kidney. Sometimes it's due to rejection, and rejection occurs when your immune system attacks this new kidney. Sometimes it's due to bad luck. Rejection can just come out of nowhere. But sometimes it's due to problems with the medication. You know, someone is not taking medications the right way, or they run out of money and they can't afford the medications. That's what we tend to see more often. But I think with the advancements, the medications that we have now are much, much better at preventing rejection. And also with the new social health authority and the promises that we are seeing, we are really encouraged to hear that the social health authority will take over the provision of transplant medication. So I think in future people will not be really worrying about the cost of medications, and that is really something that I'm excited about, and we are all excited about in the transplant world. Sometimes, of course, it could be bad luck, and I think for most people it's just bad luck. You know, you can get rejection. Sometimes we just run out of money by bad luck, and you know, life is difficult. Sometimes the economy is difficult. The last few years, especially since COVID, the economy has not been so strong, so people have been struggling with the cost of medication. So we understand, and it's one of those challenges that I think the government is responding to, and it's really encouraging to know that the government will be taking care of those medications and the costs that come with those medications.
How successful are pediatric kidney transplants?
Yeah, pediatric kidney transplants, that's transplants in children. Of course, I'm an adult, I'm a kidney doctor who deals with adults. I don't see children that much because it's not my area of training. But I've been lucky to see a few children receive kidney transplants, and they do very, very well. I think one of the beauty of being young is being young really comes with advantages. These are people who, after the transplant operation, they're up and about, and sorry, my apologies, my alarm is going off. Children come up and they're up and about within a few days after kidney transplant, and they feel 100% within a few days of receiving a kidney transplant. So that's the beauty of being young. And you know, I think one of the challenges we just see with children is, of course, around that time of teenage, there's a bit of rebellion. The body is changing, and sometimes also we need to be very cautious about the doses of medications, adjust them, because they are growing, they're gaining weight, they are growing taller. So the doses of medication need a close follow-up and frequent adjustment. So those are some of the challenges that sometimes we go through. But by and large, children do very well after a kidney transplant. So be encouraged if you're a child, or if you have a child who has kidney failure and you've been told they need a kidney transplant. It's the way to go, really.
Thank you so much, Dr. We have 10 minutes to go, and we want to spend those 10 minutes to discuss about the upcoming World Kidney Day, which is tomorrow. What will you say about it?
So tomorrow is World Kidney Day. We celebrate World Kidney Day every the second Tuesday of March. Sorry, I'm really sorry. It's not the second Tuesday. It's the second Thursday in every March of every year. And this has been going on for about 10 years now. It's a day we take to reflect about the beauty of the kidneys. You know, the kidneys that we have are wonderful organs. And we just want to remind ourselves about what the kidneys do. And we also remind ourselves about the problems that come when people have kidney problems. And then we also think about people who are going through the burden of having a kidney disease, people who are on dialysis, people who need kidney transplants, and we think about them. So this year, the World Kidney Day is on the 14th of March, which is tomorrow, and there'll be activities countrywide. I think in Nairobi, there'll be a big procession in the city, and then there'll be speeches to be given. Some of our colleagues in Nairobi will be on TV tomorrow. Here in Eldoret, tomorrow we'll be doing a procession with a team from MTRH, or Moi Teaching and Referral Hospital. We'll be holding placards reminding people about kidney health and the importance of kidney health. And then for us here, we opted to do this Facebook Live and YouTube Live video to address some of your questions just in honor of World Kidney Day. So the theme for this year is basically about access to kidney care or kidney health services, and also about the medications for kidney problems. So we are really happy that some of the things that we've been advocating for as kidney health professionals are being addressed. Dialysis is now available in most counties, so that's a good thing. We also know that transplantation services are now available. I think what we are still hoping for is that there is improvements in terms of early detection of kidney problems. And that's why we're encouraging all of you to go for yearly checkups, and to encourage your friends to also go for yearly checkups, so that in case you have a kidney problem or you have one of those conditions that puts you at risk of kidney failure, those things can be addressed early enough. And we are also pushing the government to allocate more resources to preventive health, which I think they are doing, and also availing more preventive services in terms of having more workers being out there in the villages, in the small health facilities, providing advice on prevention of kidney problems, providing access to medications for the problems that give kidney problems. So having access to diabetes medications, having access to blood pressure medications, having access to antiretroviral treatment, because HIV is one of those things also that can put you at risk of kidney failure. So we are advocating for all that, and join us tomorrow as we celebrate World Kidney Day. It also happens that Ramadan began yesterday, and on this channel we've been encouraging everyone to celebrate with our Muslim brothers and sisters the holy month of Ramadan. The beauty of Ramadan is the fasting. I think fasting is really one of those things all of us should engage in at least once in a while, to just control the amount of food we take, because food sometimes, too much food puts us in trouble. It makes us overweight, it makes us develop diabetes, hypertension, or high blood pressure, and having control over what we eat is important. So join us also this month as we join our Muslim brothers and sisters and fast. So what we normally do every year, I think Ken is also a new convert here, is we eat before 6:30 in the morning, and we don't eat throughout the day. But we, unlike Muslims, unlike our Muslim brothers and sisters, we take some water in the course of the day just to keep the hunger away. And then we eat again after 6:30 p.m. I think it's a good thing. We hope to cut some kilos. Ken is hoping to cut 6 kilos. I'm hoping to cut 3 kilos. And that would really go a long way to cutting down our risk of developing diabetes or high blood pressure, and hopefully give us a better quality of life. So join us in our yearly Ramadan fasting challenge.
I have 2 questions just to close up the live. Is it after the kidney transplant?
Yes.
Will I stop taking my antihypertensive and anti-diabetic medications?
Oh yeah, that's a very good question. So after a kidney transplant, if you had diabetes before or you had high blood pressure before, what happens? Do you stop taking your diabetes medication? Do you stop taking your high blood pressure medication? Very nice question. So after a kidney transplant, we assess everyone, and we keep a watch for the sugar level. We watch the blood pressure. In general, people who have diabetes, when they receive a kidney transplant, the diabetes comes back, and it actually tends to come back a bit stronger. So usually it's something not very difficult. We normally keep it under control, and we talk to the patient about their diet, about their medication. And for most people, we are able to control the diabetes after the kidney transplant. And usually it doesn't come back to bring problems. Blood pressure, on the other hand, for most people, once they receive a kidney transplant, their blood pressure tends to be less of a problem. So if you were taking 3, 4 medications while on dialysis, for most people, once they receive a kidney transplant, the number of medications comes down significantly. And for some are really lucky that they actually do not need medications at all. So we look at everyone after a kidney transplant, and we advise them about the need for ongoing medications. But in general, diabetics or people with diabetes tend to still need their diabetes medication. People with high blood pressure tend to need less medication or even none. But we must monitor and follow up everyone. We don't just stop blindly. We watch everything.
And the last question someone is asking is, after the kidney transplant,
yes,
you are given 1 kidney.
Mm-hmm.
So basically, before transplant, the load was divided into the 2 kidneys. Now, does it mean that when you get the kidney, does it overload that kidney?
Very good question. I really like that question. So when you receive a kidney transplant, like we said, the old kidneys, we don't touch them. And we put a new transplant somewhere in your groin, usually on the right. And at that point, you have 3 kidneys. But of course, 2 are not working, and the new one is working. Now, let's go back. We normally tell people that you were created, for those of you who believe in creation, you were created with 2 kidneys. 2 kidneys is actually a bit too much for you, in quotes. You can live a normal life with 1 kidney. So that's why you are able to donate 1 kidney to someone else and still live a normal life with the remaining 1 kidney. Now, when someone receives that 1 kidney, the other 2 kidneys are not working, and that's why we give you that 1 kidney. So really, you are running on 1 kidney. And I don't think there'll be any overload or overworking of any sort. So it's okay. I think we are able to live a normal life with 1 kidney. And that's why the person who donates remains with 1 kidney, no problem. And the person who receives is receiving 1 normal kidney, and they are okay. So it's okay.
Thank you so much, Dr.
Is that the last question?
Yeah, the last question.
Yeah, it's been nice. I think we've really enjoyed taking your questions. It's been a nice afternoon. We really apologize for we had a few technical glitches connecting our Facebook. We apologize for that sincerely, and we hope to do a better job next time. We'll be back in a few weeks, maybe in 2 weeks or so, or maybe a month. we keep tuned in, and we'll be posting our updates on the group. I think we've really enjoyed taking your questions, and we'll be happy to come back and take more questions from you. So keep tuned in, and keep sending in those questions, and we'll put up a poster when we will do the next live broadcast. I think we are really enjoying this, and I hope you people are also enjoying. We are happy to take your questions anytime, but because of the nature of work, we'll dedicate some hours, maybe an hour every 2 weeks or maybe every month, and just answer questions live on this platform. So we are really happy to do this, and we hope that this will bring more knowledge and arm you people with the knowledge to advise others, and also personal knowledge to know the status of your health, and to take that step to go for the annual medical checkup. Just know the status of your kidneys. Do you have a kidney problem? Do you have high blood pressure? Do you have diabetes? Is your weight excessive that you need to cut down some kilos? You know, things like that. So we encourage you to take the message, the clarion call from us. Go for medical checkup. Thank you very much, and welcome again to our channel. Bye-bye. Okay, are we done?
Yes.
How did it go?
It was good.
Sylvia is excited.
Yeah.
You enjoyed it?
Yes, it was. And at least people asked questions.
Okay.
Yeah.
How did it go, Fundi wa mitambo?
Thank you so much.
You sorted out the mitambo.
We wish that
What yes.
Nini tena?
We sorted.
Bado nasumbua?
No, we are
The
both.
second bit is okay.
someone is saying,
Mm.
thank you so much, Daktari. We wish that you post this poster on YouTube because of those who came late.
Mhm. Okay.
So, you're recording. So, my record.
Iko YouTube.
Yeah.
It's just a continuation of the same link.
I'm actually surprised I liked it. Just
Nice.
talking to a camera
Yeah.
and